Sorry. Okay, imagine the person you love wakes up one day and completely forgets who you are. Let that sink in for a moment. How does that feel? Depressing, right? Although Alzheimer's has not been in the media recently, it is a globally known disease that affects 1 in 3 seniors, meaning that at some point in your life, you will all know or know of someone who has contracted this illness. I personally have been put in a position where one of my best friends had a grandmother who contracted this disease, and because of it, I've always wanted to learn more about it. So I researched it. Learning about Alzheimer's will allow us to will give us a better chance to prevent the illness from happening to us and to someone we hold very dear to our heart. First, I will talk about what Alzheimer's is and how it was discovered, the stages and symptoms of Alzheimer's, and lastly, the prevention and ways you can treat Alzheimer's. So first, what exactly is Alzheimer's? Alzheimer's is, according to the National Institute on Aging at nih.nia.gov, Alzheimer's is a progressive brain disease that slowly deteriorates the way someone thinks and their thinking skills, preventing them from doing daily tasks. Alzheimer's has increased by 68% from the years 2000 to 2010 and is the 6th leading cause of death. So how was Alzheimer's discovered? Alzheimer's was discovered by a German physician according to the ALSA, or the website for the Alzheimer's Association, last accessed on February 5th of 2014, and was discovered by a German physician named Dr. Alois Alzheimer's, who noticed a strangely large deposit in and around the nerve cells of a patient named August D., who showed profound memory loss and had confounding suspicions of her family and other worsening psychological conditions. So now that you have a brief history of what Alzheimer's is and how it was discovered, we can now move on to the stages and symptoms. In order to understand the symptoms of Alzheimer's, in order to understand Alzheimer's better, we first must understand the symptoms, and in order to understand the different stages. As you can see right here, there are 10 early detection signs of Alzheimer's, except because of the crunch in time, we only have enough time to go over a couple. And according to WebMD, last accessed on February 4th of 2014, the common symptoms of Alzheimer's include a deterioration in the memory, meaning that it's very difficult for the patient to memorize things or to learn new information. They become disoriented and they get confused. They can't perform daily tasks such as picking clothes for the weather. So that if it's in the winter, they could be wearing shorts, or when it's pouring outside with rain or snowing, they'll be wearing sandals. And they also have a change in their behaviors, and they also have a change in their sleep patterns. So moving on to the different stages of Alzheimer's, there are either 7 or 8, depending on the charts that you decide to look at. Except for this one, there are 8 stages, as you can see. Stages 1 and stages 2 are considered the normal stage because there are no evident signs or symptoms to the patient, meaning that if they go into a doctor's office, they cannot be diagnosed for Alzheimer's because there are no signs. And as we get to stage 3, it is considered the mild stage, where the patient first begins to show symptoms where they become forgetful. And as we reach stage 4 is when their friends or their family begin to notice that something is changing around them, that they're not who they used to be. And as you can see, the more we progress up the chart, up to stage 7, the symptoms get worse and worse. And at stage 7 is when the patient can no longer function on their own, meaning that they have to have a caretaker with them 24/7 because they can't smile, they can't make any type of facial expressions, and they basically just can't function without someone taking care of them. And stage 8 is known as the terminal, where the patient is no longer here in the physical world. And now that we have gone over what Alzheimer's is, the symptoms and stages of Alzheimer's, we can now move on to the treatment. The treatments for Alzheimer's include drugs and non-drug medication. And these medications include antidepressants or antipsychotic drugs that help with your memory loss and changes in behavior and sleep patterns. The non-drug treatments include coconut oil, which are herbal remedies. And according to DrOz.com of May 30th of 2012, there is a 5-step prevention plan. The first step is to take a DHA supplement, which is an omega-3 fatty acid, and it is tuna. Step 2 is to mix up your daily routine, such as if you brush your teeth with your right hand, you switch it to your left, or you write words backwards. And the reason you would do this is because it cross-trains different functions of your brain. So that way you're working like areas of your brain that aren't always in use when you use the same hand. Step 3 is to de-stress yourself and basically just relax. Because I cannot stress this enough, but relaxing is the best thing for your entire body. Step 4 is to create a list of things, such as like a vocab list or something, and associate the words with different things in life. For example, when you think of the word baker, you can associate it with a person wearing a white apron or like a fluffy hat holding a piece of bread, like so. And the last one is very interesting, actually. Most of you don't know, but they're called brain push-ups. And basically what you do is do at least 7 push-ups a day, and that will help increase the blood flow in your brain and create new brain cells. So now that I have gone over the symptoms and stages of Alzheimer's, what it is and how it was discovered, the treatment and prevention of Alzheimer's, we can now begin to wrap things up. Alzheimer's is a disease that affects pretty much seniors, and by knowing what it does, we can help prevent ourselves and from the people we love from contracting the illness. So first, I went over what it is and how it was discovered. Second, I went over the stages and symptoms. And lastly, I went over the possible ways you can prevent and treat the illness. So at some point in our life, we will encounter someone who is suffering from a severe illness, or we ourselves can suffer from it also. But the best thing to do is to understand what it is in order to help cope with the disease and prepare for what may happen in the future. And that's my work set.